Hello, welcome to our next webinar in our Lifestyle Medicine series. I just want to start with a brief introduction explaining the nature of our Lifestyle Medicine program at the Mass General Cancer Center. We are really thrilled to hold this 6-part webinar series where we're exploring strategies to improve health and well-being for 2024. We're thrilled that you've joined us today. Some of you might ask, what is Lifestyle Medicine? Lifestyle Medicine program provides evidence-based information for cancer survivors and thrivers and those living with cancer about strategies to improve quality of life, alleviate symptoms post-treatment, and promote the adoption of healthy lifestyle behaviors after a diagnosis of cancer. Our clinic provides individualized consultations for patients as well as group visits. We are so excited to have 2 great speakers today. I will note that at the conclusion of today's webinar, there will be an opportunity for Q&A, so you can feel free to type your questions or comments in the chat box or in the Q&A box at the bottom of the screen. So today's webinar is entitled Reclaiming Self, Navigating Identity and Body Image After a Cancer Diagnosis. We have 2 amazing speakers, Dr. Mitra McLarney and Dr. Laura Petrillo. Dr. McLarney is a physical medicine and rehabilitation physician with specialized training in cancer rehabilitation and pain management. She collaborates closely with patients throughout their cancer journey and how they can reach their functional goals and enhance their quality of life. Dr. Petrillo is a palliative care physician investigator in the Division of Palliative Care and Geriatrics at MGH, and now she's very involved in lifestyle medicine as well, so we're thrilled to have her on our team. She's an assistant professor of medicine at Harvard Medical School. Her research focuses on improving supportive care for individuals with advanced cancer in the precision medicine era. Thank you so much for joining us, and now I'm going to turn it over to both of you.
Great. Okay, I'm going to share my screen. Okay, and it's not in presenter mode yet, but just 1 second. Does that look good?
It looks great.
Okay, great.
All right. Well, hi, everyone. Thank you so much for joining us today. Again, I'm Laura Petrillo, and we're going to be talking about reclaiming self, navigating identity and body image after a cancer diagnosis. So on our agenda today, we're first going to talk a little bit about identity in cancer and all of the different aspects of people's identity that can be affected by cancer and going through cancer treatment. Just to remind everyone, the number of cancer survivors in the US is continuing to increase, and we anticipate that by 2040, over 26 million people will be living with cancer in the United States. And we define survivor for the purposes of this talk as anyone living with a diagnosis of cancer. So from the time of diagnosis through the end of life. So that includes being on active treatment. It includes having finished active treatment. It includes having cancer that someone's living with for the rest of their life. So, and it also, I also think about survivor, including the loved ones who are affected by cancer as well. But this number refers to the people who have a diagnosis of cancer, and it is a growing population of people who are dealing with cancer in some way, shape, or form. So to turn to our talk about identity in cancer, well, first, we will be, this is a wonderful quote. Sorry. This will kick us off, actually. I don't know if anyone is familiar with this book. It's a beautiful book by Salika Jawad. It's called Between Two Kingdoms. And I just want to read this passage to you because I think it really frames our conversation beautifully. So there's a quote from Susan Sontag in this book, and it goes like this: "Everyone who is born holds dual citizenship in the kingdom of the well and the kingdom of the sick. And although we all prefer to use only the good passport, sooner or later, each of us is obliged, at least for a spell, to identify ourselves as citizens of that other place." And then Salika reflects on that quote in the book. She has been dealing with a diagnosis of cancer herself, and she is trying to get back to feeling like herself. She says this realization that she has that night, I began to think about how porous the border is between the sick and the well. As we live longer and longer, the vast majority of us will travel back and forth between across these realms, spending much of our lives somewhere in between. These are the terms of our existence, and the idea of striving for some beautiful, perfect state of wellness, it mires us in eternal dissatisfaction, a goal forever out of reach. To be well now is to learn to accept whatever body and mind I currently have. So today we'll be talking about these different aspects of identity and ways, first of all, that cancer can affect these aspects of identity, some common things that have been studied and described in the literature, as well as some approaches to try and reclaim the parts of yourself according to these different domains, some strategies that might be that are worth considering to sort of try and bring these parts back into focus. And on the next slide, I'm just showing this icon because when we show a slide that has some strategies or suggestions, it's just going to have this little plug icon to say, here are some ideas of how to replug, recharge, and kind of reconnect with your identity. And I want to say too, Mitra and I certainly don't have all the answers. So we fully acknowledge that. What we're hoping to do today is to describe some of the things that other people are dealing with, so that if you're dealing with that too, that you feel less alone, and that you know how common some of these concepts are. And then also just provide some suggestions of things that maybe you hadn't thought about in this context, and maybe resources that you might not have known about, as well as describe ways that approaches have been studied that could be useful for you. So we're going to start with physical identity, and I'm going to turn it over to Mitra.
Thank you. So like Laura said, we'll start with physical identity. And just to say, there's a lot of factors that can go into how someone perceives their physical identity. But what we'll be really focusing on here is body image. So body image is defined as the perception, evaluation, and derived feelings about one's body appearance and physical functioning. And so we'll be focusing on how this can be affected by cancer and cancer treatments. I'm going to start with a quote, and these are going to be something that we'll see throughout as we're talking about each component of identity that we highlighted at the beginning of the presentation. And these are quotes from cancer survivors that have been asked about these certain aspects of identity. And so just to kind of give a little bit of a background to start out each of these little topic areas. So this is a quote that was from a cancer survivor, and it goes, "At this point now, if they even call you skinny, or if they call you slim or anything, they're kind of meaning it in a derogatory way. Just because, oh no, you look really skinny, you need to eat something. I've never really had to deal with that before, because I've always been bigger. It's just different. I don't know if there could even be a good term at this point, because even if I am eating right and eating like I'm supposed to be doing, but I'm skinnier than I used to be, people still look at that as it's because you're sick." So it's been reported that somewhere between 15 to 75% of cancer survivors have at some point during their cancer journey some concerns about body image or embarrassment from body changes, which really is a majority of patients that are experiencing this sort of concern. And there's a number of different ways that cancer can affect one's body image. So here is just a list of some of the ways that we commonly see cancer affecting one's body image. But this is not by any means meant to be a comprehensive list. So because of treatment, you may experience some hair loss. There can be skin changes. So there can be changes to the texture of the skin, to the dryness of the skin. There can be some scars from treatments, surgeries, and different things that go on throughout the cancer journey. Swelling can occur, either related to lymphedema or to another component of medications. or other risks that could occur from other comorbid conditions that are related to cancer. There can be weight changes, just like that quote we started out with. There can be weight loss or weight gain. There can be some anatomic changes. So some individuals may lose limbs or have changes to their limbs. And then some people will have some bowel or bladder changes that can result in requiring a urostomy or an ostomy, which can definitely have impact on how one perceives their body image. There has been a lot of interest in kind of identifying factors that may affect how one perceives their body image. So here is just a list, once again, not meant to be a comprehensive list, but just to say that there have been things that can influence how body image is perceived. In general, there have been thoughts that younger individuals who are diagnosed with cancer and are undergoing treatment have maybe more negative perceptions of body image, or individuals who are at higher body mass index. So that's like the weight to height ratio that is often used, may have some more negative perceptions of body image based on the type of cancer an individual has or the cancer treatment that they may get. So an individual who has breast cancer possibly and is undergoing a mastectomy procedure may be at higher risk of having a negative body image. Active treatment, so individuals who are actually actively getting treatment also tend to have a more negative body image on average. And then there's some evidence, not the strongest, but there's some evidence that educational status, so individuals that are of higher educational levels may have a better body image than those who are didn't have as high of an educational status. Individuals in a stronger relationship who have been married for longer periods of time may have a better overall body image. And then individuals who are at risk of anxiety or depression or had poor perceptions of their body image prior to diagnosis may have more negative body image later on as well too. It's really important to talk about this topic though, because the impact that negative body image can have on one's health is pretty vast. It can really be associated with a lot of negative other sequelae. So that includes a negative perception of quality of life, a negative perception of self-esteem, more social isolation. It can add to anxiety and depressed mood if you already may not have been having as much of that prior to diagnosis. It can definitely help. It can definitely facilitate that happening for you. So it really is an important area to take note of. But there are some strategies that are out there to combat negative body image. So as Laura mentioned, this is our image to kind of just show there are definitely things that can be kind of tried to help improve one's perception of their body image. So one of the biggest things is really acknowledging and grieving the changes that have happened to your body. Recognizing that there have been changes is a huge first and most important step in the beginning of navigating changes to the body image. It's also important to notice if you're having negative thoughts and ask for, friends, family for support. Ask your healthcare providers for support if you feel comfortable doing that. One of the other things that has been suggested is kind of changing up your style or engaging in self-care, doing things that you may not have done before, and taking advantage of self-pampering things such as massages or pedicures. And then one of the other things really to highlight is, from that first slide where we're talking about the number of individuals who are going through this and may not be as visible, connecting with other cancer survivors via support groups is a great way to also try to combat some of those negative body images. Seeking assistance from your team, seeing if there are resources available to you, and then some evidence for music and art therapy, as well as exercise. And here, I just wanted to actually give a further plug for exercise. Exercise has a lot of positive impact on body image, but it also has a number of other benefits in terms of cancer care overall. So it can result in improving mood, increasing energy, improving muscle and bone strength, improving fitness, improving balance, improving quality of life, and facilitating social connections. And that is only a partial list of all the benefits that exercise has. So if you are able to kind of add in some exercise to your daily regimen, it has a lot of potential beyond just body image. I will say too, there has been evidence that exercise of all types really can be helpful in improving body image. So that means both resistance-based work, aerobic-based work, not limiting to one certain type of exercise, but really just getting out there and moving has a lot of benefits. So I list some of the things that they've looked at before, like yoga, Pilates, running, swimming, weightlifting, but definitely not a comprehensive list and not something to kind of limit yourself to if you enjoy another kind of activity. And then I just wanted to add one more plug here, because anytime I get a chance to kind of mention this, I think it's really important to take note that the American College of Sports Medicine really recommends, has some recommendations for physical activity in cancer survivors. And it's really a combination of aerobic exercises, strength-based work, and daily stretching. And I have listed here below the little images what the recommendations in terms of time or frequency of these activities are. So for aerobic-based work, we're talking about at least 150 minutes of moderate exercise a week, which could be walking or light swimming. If you are able to and enjoy doing more vigorous exercises like jogging or running, that time goes down to 75 minutes per week. And that's not to say to do that all in, large chunks. It can be broken down even into 10-minute intervals of time throughout the week. And then in addition, there's recommendations to do 2 times of strength training for each major muscle group per week, and then to do some daily stretching. And I know that this whole thing can seem very daunting as well, but I think it's a great way to just kind of frame thinking about exercise and thinking about just getting moving and recognizing that reaching this point may not be something that is an immediate intervention, but it really kind of thinking about that in the long term. So always just promoting exercise because it has so many health benefits in the cancer survivor population. And then I'm going to now switch it back over to Laura to talk about some symptoms.
Great. Thank you, Mitra. So another aspect of our physical identity is how we're feeling and how that affects how we think about ourselves. And so just to say, symptoms, as everybody knows, are something that a person feels or experiences that may indicate they have a disease or condition. So just relating kind of physical sensations to a health condition. Next slide, please. These are some more quotes from people who are dealing with one of the most common symptoms that people with cancer deal with, which is cancer-related fatigue. And again, just want to read some of these quotes in case you might be able to relate to what other people are dealing with and see how people who are dealing with this symptom relate it back to their sense of self. So one person said, "Cancer-related fatigue is not exhaustion. I've been exhausted. I have never had fatigue like this. It's not work fatigue or emotional fatigue. It's very different. It's incredible. It's like rubber knees. All of a sudden, everything's fine, and you just start sinking, and there's nothing to hold you up." Another person said, "I was completely exhausted and in despair, living in a state of absence with regard to myself, and my fatigue no longer served as an alert to the gravity of my condition." So just saying that how much fatigue can change how somebody feels about feeling like themselves. So fatigue is really common, is under-recognized, and as I was alluding to, it can be sort of a thief of the sense of self. About half of people with cancer overall deal with fatigue at some point. Among people with advanced cancer, that number is even higher, 60%. It's also higher among people undergoing active treatment. Fatigue is a difficult one because it can be under-recognized or underappreciated. We all get tired sometimes, but as those quotes illustrated, cancer-related fatigue can be quite profound, and it can be really hard for people who haven't experienced it to relate to. When people experience fatigue for a long time and don't see an improvement, it's not uncommon to develop a sense of futility, that it's something that's just going to be there all the time. And it can limit the ability to do activities that make people feel like themselves, like walking or getting out of bed, doing household tasks, socializing with other people, or working. And that sense of fatigue and loss of control can lead to a feeling of loss of purpose or change in identity from an active person to an inactive person. So some strategies for managing fatigue. You'll notice that a lot of the strategies we're providing are not medications. So these are behavioral things you can do. These are changes in mindset to start to think about how to manage. And it's not to say that any of these is a silver bullet, but just to start to think about ways that you might adjust a little bit of how you're going through things. So one of the key pieces for managing fatigue is pacing activities. We sometimes will estimate what we're doing according to the bodies that we had before. And according to the abilities that we had before. And it may make sense when our physical function is different to just sort of pace ourselves. And the last bullet is around adjusting expectations and accepting health. I think these things go hand in hand. So sort of another piece of pacing is identifying those moments where you feel the best, the times in the day or the times in the treatment cycle when your energy is best, and then just planning your life around those times and giving yourself the opportunity to rest at other times. It isn't always possible, but if you can start to notice those patterns and pay attention and just follow the cues that your body is giving you and be a little bit gentler about yourself about resting when you need rest, the resistance around the fatigue, at least that layer of stress might go away. It's really critical to maintain good nutrition and to optimize sleep. And as Mitra was saying, exercise and physical activity has really an enormous number of benefits. And it's a little bit paradoxical. I always say, people think I'm tired. Why are you telling me to just go exercise? And I totally can hear that. And I've had so many people also tell me, once I started moving, I find that I have more energy. And the reason that this happens, people build muscle, they have more appetite, they sleep better. There are just a lot of ways that being physically active sort of increases our energy level. So it doesn't have to be something monumental. It can be starting small with something that feels approachable and just increasing slowly over time. And I already mentioned this about adjusting expectations. I think one of the biggest things for disappointment is expectation and reality mismatch and sort of taking stock of where you are and what feels like a reasonable level of activity for you, and then sort of just making sure that as you're pacing yourself, you're setting yourself up for success with your expectations. And this piece can be super hard, accepting help from others, but it can be critical to getting back to the activities that you enjoy. I'm going to mention another, what I would say it can be like a thief, which is pain, another super common symptom. A third to half of people receiving active treatment, 2/3 to 3/4 of people with advanced disease, just incredibly common for people to experience pain at some point. I think anybody who has experienced chronic pain can probably relate to the sense that their identity feels a little bit changed by their changing ability to function because of pain. And that same sense I was talking about of needing more help from other people can also, not for everyone, but sometimes it can make people feel like they're not themselves, that they don't have the abilities they used to have, and it can change how they relate to other people. One thing with pain is that it's not usually visible. It is so dependent on the person, and it's stigmatized in our society. And so it can be hard to get the support you need around having pain. Pain can cause a lot of different downstream problems, and it also, like a chicken and egg, can be made worse by other health conditions and psychological conditions. So dealing with depression and anxiety can amplify pain. Likewise, pain can amplify depression and anxiety. Loneliness is associated with pain. The sense of catastrophizing or taking a thought and kind of imagining the worst possible outcome of that thought. Having a fear of recurrence, a really another common psychological condition, is associated with the experience of pain, meaning that people who experience fear of recurrence are more likely to experience pain and vice versa. Fatigue, insomnia, and decreased physical activity all have been associated with pain in studies. So again, I'm not going to be talking about medications per se for managing pain, and I think that that's an important thing to discuss with your team and can be part of the strategy. But the other things that people can do for managing pain include some psychological and behavioral activities. So again, I feel like we're a little bit of a broken record, but physical activity can be really helpful for pain. In particular, yoga is something that has been demonstrated in studies to be helpful for chronic pain. And there are certain types of therapy that people can pursue, particularly cognitive behavioral therapy, to help with managing the thoughts and behaviors that come along with signals from our body. And the way I think about that is that sometimes signals from our body can be sort of like a stereo, and kind of our thoughts and behaviors can sort of turn the volume up or down on the stereo. And I think of therapy as a way to sort of take back control of that volume dial and affect how your mind and your body are responding to the signals that you're getting. Meditation and mindfulness-based approaches like relaxation can also be really helpful. Again, not necessarily with changing the stimulus, but with changing our body's response so that we're in a better position as we're experiencing something like pain. And hypnosis, as it turns out, which seems to be kind of related to some of these meditation or mindfulness things, but has been shown to be powerful as a strategy for managing pain, as it turns out. So we're going to move on next to some psychological changes that can affect identity, and then drill down on one particular psychological change, and that's dealing with uncertainty. In these next quotes, we'll talk about that. So this was a quote from a qualitative study that we did with people living with lung cancer and their caregivers. And I thought that this quote from a caregiver just really beautifully captured how uncertainty can affect identity. This caregiver said, "Just generally, life isn't the same. And even though she's the one dealing with it, it's a part of me that I feel has been lost. Because I think as humans, we see ourselves in the future. We always look at a better version of ourselves in the future. And then when something like this comes up, you don't really see your future for a little bit, and it takes the wind right out of your sails." So uncertainty and illness, there's a theory about uncertainty and illness that was developed by a nursing scholar in the 90s, Merle Mitchell. And the way that she described the effect of uncertainty related to illness is that as uncertain disease-related or illness-related factors are introduced into a person's life, uncertainty can compete with the person's previous mode of functioning, and abiding or continuing uncertainty can sort of dismantle the existing cognitive structures, give meaning to everyday events, and reduce the sense of mastery over the events and enhancing the sense of danger. Next slide, please. So it's really common to feel some type of distress. And when I say distress, I mean emotional, social, spiritual, or physical pain or suffering that is related to the uncertainty that comes with cancer. And uncertainty about how things can change due to cancer can sort of spread in that way that that quote from Michelle explained, to other aspects of our life, and just sort of make the whole ground under us feel uncertain. And this relates to identity because it sort of threatens that future self that the person in the quote was talking about, threatening our valued attributes, our roles in society, or our abilities. So this doesn't have the little plug icon, but it ought to. Some ways to cope with distress related to uncertainty. I think one of the keys is just first noticing, like anything else, when it's happening. So just notice you've got a thought that pops into your head. I've heard a few people say this thought: I wonder if I'll even be here to see the new buildings at MGH finished. Like just a thought, like, I wonder if it's even worth it to buy the jumbo size rolls of toilet paper at Costco. having that thought can lead to a feeling of anxiety. It might be a totally involuntary thought, but just noticing that thought and noticing the feelings that it can provoke and then the behaviors that it can provoke are a way to sort of break that cycle. And so if you're noticing kind of where you are and what's going on is the first step to sort of taking an approach to break it. And I'll say too, a lot of these strategies are things that people can do on their own, or they can do through apps or through programs, but also working with a therapist. This is the type of thing that working on with therapists can be really powerful to deal with distress related to uncertainty that gets to be overwhelming. And there are some different ways that you can sort of approaches that you can take to deal with the feeling of feeling out of control. And they have to do with kind of taking one piece of this cycle and focusing on it. So if it's that you're feeling overwhelmed with emotion, sometimes just finding something that's soothing, taking a nice bath, changing your scenery so that you're in nature, talking with a friend on the phone, just trying to say like, I'm really overwhelmed right now. I don't have the capacity to like manipulate, to deal with my thoughts and like try and get myself to a better place cognitively. I just need to like have a warm blanket type feeling, totally fair. And sometimes that's enough to break this cycle. But sometimes if people are in a secure enough place, they may be able to take that thought, put it under a microscope and say, you know what, it may be that I won't be here, but maybe I will. I don't know. I'm just going to take it one day at a time. And, try and talk with yourself the way that you might talk with a friend, just to sort of show yourself that same gentleness, kindness. Maybe it's taking a thought that is catastrophizing or taking things to an extreme and just saying, this is maybe this thought isn't a totally fair assessment, and maybe give it a more gentle way to say it, which is not to say that you take responsibility for having these thoughts. I really believe that some of these thoughts kind of pop into our minds, but then we have a choice about how we respond to them. And then another way, some other ways to deal with it are distracting yourself, or some of these mindfulness techniques like relaxation or slowing your breathing. And so then our next piece is going to be actually around social identity. And this quote is from someone talking about, I don't want to be the main attraction. Of course, people look at you or ask you things. There's always a moment of hesitation, although not with the inner circle. It's more those people who aren't quite so close. There comes a time when you don't always feel comfortable with it or strong enough, or you really don't want to discuss it. You perceive it differently. It's a very serious business, not some lighthearted social occasion. And so this is about cancer and social identity. So cancer affects how people feel and act in social situations and relate to others. People with cancer in qualitative studies have described that they feel sometimes like cancer can become almost like a central part of their identity in relation to other people. So friends and loved ones may focus on excessive attention on their cancer and talk about that when they talk with them, rather than other aspects of their lives. And this may wax and wane, and it may be different with different people in your life. And sometimes people might feel that people treat them differently, like with kid gloves, or they might feel isolated and excluded from activities, maybe because of how they're feeling, or just feeling just totally on a different page. I do want to acknowledge, though, as we all have sort of recognized coming out of the pandemic, but in general, social connection is critically important to health. It's important to health, it's important to mood, it's important to quality of life, cognitive function, resilience, and the ability to bounce back from stressors. And it doesn't have to be a huge thing, but taking little steps to increase social connection. And these are taken right from the CDC website. Trying to spend more time with family and friends, getting out in nature if that's meaningful to you, finding ways to express gratitude to others and about things in your life, finding community, either through volunteering or through other kind of ways of getting together with people with common interests, getting to know your neighbors, joining a community garden. I think one of the key pieces is just recognizing the network that you do have and nurturing those relationships. Taking those steps can pay such gigantic dividends. And sometimes we don't feel like it. And I always think about sort of faking it till you make it. Just like put yourself through the motions of picking up the phone, sending a text, making a phone call, just to maintain those connections, because it's so important for your health. I think of it as important as taking your medicine.
And now we'll go into sexual identity. which is something that is very often overlooked or maybe not talked about as frequently. So this is a quote that we'll start this section out with. And I do not know, when you go into that experience, you are kind of just in survival mode and you just have to kind of get from one thing to the next. You have to get through it. And so I feel like, during that time, our relationship sort of kind of was on the back burner. I do not want to say that it kind of put a wedge between us, but it's sort of, there's a little bit more distance between us than there was before. And it could have been just, because we were so focused on getting through the terrible experience of going through cancer treatment. So there is a lot of impact that cancer can have on sexual identity. More than 60% of cancer survivors will report some level of long-term sexual dysfunction after cancer treatment, but yet very few people will actually seek help for it, at least from healthcare providers. So from the same study, they found that less than 25% of individuals would get help from healthcare providers regarding sexual identity. And there's likely a lot of factors that play into that. Comfort in asking for assistance, both on the cancer survivor side and on the provider side. This image on the right side is really to show that how many different factors can go into how individual may experience cancer-related sexual problems. So there is definitely biological changes that can occur. There can be changes because of hormonal differences in the body. There's changes in the body's integrity itself. Like there may be some loss of a body part or lack of sensation, pain, fatigue, all of which we've kind of highlighted before, but they can all definitely play an impact on sexual identity. There's psychological aspects, emotions, cognition, motivations that can impact sexual identity. Social, cultural expectations and norms can definitely also have an impact. So one's religious beliefs, cultural values, social norms, like we just said, and then the interpersonal relationships. So the discord between an individual and their partner in a relationship, a fear of intimacy, or just lack of communication around it can all kind of factor into how someone may be experiencing their sexual identity and experiencing sexual problems. This is a table really just to show a couple of key things I wanted to highlight. On the left side of the screen, it does show cancer diagnoses. And what I wanted to say about this was that there really is not one type of cancer that is, immune from having sexual problems related to cancer treatment. Oftentimes, people may think that cancers of primarily sexual organs would be the ones that tend to be the ones most affected, but there are definitely evidence out there to say that individuals who have cancers of different types and of all types can have sexual problems. And so really to just kind of say it's normal and it's not something that is limited to only certain groups. And then the other thing I also wanted to just highlight is this third column in the middle that kind of shows the prevalence. And that really is also to say that this is something that's very common. In some areas, almost everyone is experiencing some aspect of sexual problems related to their cancer. So it's definitely a very common thing that people may experience. There are some things that can be done to try to manage sexual identity. And some of these are suggestions of kind of, like Laura said, we're trying to avoid the medications, although I do mention some medications, but a lot of these are things that you can do behaviorally. So biggest thing is kind of identifying your motivation, self-efficacy, focusing first on pleasure and not necessarily on sex, having an open communication with your partner, getting moving. So that exercise is really kind of coming throughout this entire presentation. And then there are medications that would be something to definitely discuss with your provider if you're having specific issues that may benefit from a medication or from a treatment. And then rehabilitation. So doing activities kind of that are focusing on the pelvic floor, doing stretching, doing different things to kind of increase pelvic blood flow are all things that can be done to try to help mitigate some of the changes that can occur to sexual identity. And now we'll just touch on the last component of identity that we were going to focus on today, and that's really on functional identity. So functional identity is defined as the roles, activities, and tasks that define how individuals perceive their abilities and contribute in various aspects of life. So that can include how an individual participates in work, their daily activities that they may do. So from things from cooking, showering, all the way to paying your bills, and activities that they value doing outside of work and daily activities. So we'll touch on each of those briefly. And this is a quote to start this section as well. I know for me, being home after working all the time, not having a sense of meaning kind of in my life that I got from work before, that was a big challenge. And so much of my identity was tied up in my work, my profession, my relationships with my colleagues, and all that kind of stuff. So when you take that away, it makes me question, who are you? What is your identity? So first we'll touch on work and cancer. The majority of cancer survivors are employed at 2 to 3 years after diagnosis, but there can be a lot of challenges to going back to work. And some of these are highlighted here, but there can be a lot of factors that may make it very difficult to actually feasibly go back to work or to go back to the job that you had prior to diagnosis. So higher risk of unemployment than healthy controls in cancer survivors. There is a fear at times to disclose diagnosis because of fears of how your colleagues or the workplace in general may view you. An inability to work the same way because of decreased tolerance, fatigue, pain may also be factoring in at that into how you're tolerating your day-to-day. Lack of accommodations at work. So that can definitely impact things if you're not able to do some of the activities in the same way that you were expected to do them before. There can be decreased income because of some of the accommodations or not being able to tolerate the same level of work that you were doing prior. And then just also uncertainty about how to, return to work, what the policies are to return to work, what resources are available for returning to work, and, that other ways that work can be a component of how cancer survivors enjoy their activities. So there are a number of strategies to return to work. It is your decision. I think that's the biggest thing. If and when you want to tell coworkers about your diagnosis, it's not something that you should feel like you're obligated to do. It's also important to remember that there are legal protections against individuals with cancer and individuals that may have disabilities related to other things. So there's the Rehabilitation Act and the Americans with Disabilities Act. You should be able to seek accommodations. So whether that is new equipment, getting a part-time or modified schedule, which may be the best way to start a return to work program, is really to kind of start out at a more part-time schedule or with modifications and responsibilities, or in a schedule that is more conducive to your treatment. So maybe only going in on days that you don't have treatment. And then there are programs that are vocational rehabilitation programs, and there are some in the area, but there are few of these. These programs are really focused on how to get an individual back to their previous employment. So There's a lot of rehabilitation services that are, but it's the primary focus of it is to get you back to your primary employment. So if that's something you're interested in, please, reach out to your providers and see if there's anything in your area that you can take advantage of. Now to just touch on daily activities. So daily activities are activities, like I mentioned before, that are things that we can do from just things such as personal hygiene, housework, all the way to more complicated tasks like shopping, bills, and cooking. And 30 to 50% of adult cancer survivors need some assistance with activities of daily living. And when you lose the ability to do activities of daily living, it can really lead to a feeling of loss of independence, requiring someone else to help with things that you used to do regularly all by yourself, can be a little frustrating at times for individuals. So why does this happen? This is by no means, once again, is a comprehensive list, but cancer treatment can really lead to deconditioning. Treatment-related changes can just lead to difficulties with tolerance. You may be more fatigued, may have some cognitive difficulties because of cancer treatment that makes it more difficult to focus on these tasks. Anxiety, depression can also contribute as well. But there are interventions as well that can be pursued. So definitely reach out to your team if you feel like you could use more assistance in this realm. Sometimes getting physical therapy, occupational therapy involved can be really helpful for task-specific activities. Adaptive technologies as well can be really helpful. So whether or not you needing to use some sort of device to assist with ambulating versus something to assist with computer work, like artificial intelligence. There are other interventions in those realms that can be very helpful. And then a plug just in for cancer rehabilitation as well. If you aren't really sure where to start or what the difficulties are, that may be a good time to seek assistance with someone who has a particular interest in cancer rehabilitation that may be able to help kind of guide that process for you. And then lastly, just to really touch on valued activities and hobbies. So it's really important to how we define ourselves is the things that we enjoy doing. There are a lot of physical and emotional impacts of cancer that can limit, though, the involvement in previously enjoyed activities. But participating in hobbies really does lead to an increased level of health-related quality of life, emotional function, social function, and can help decrease stress. There is also some evidence, specifically in breast cancer patients, that it can help decrease risk of death and improve curability. But there are a lot of barriers to going back to doing hobbies after a cancer diagnosis that can include fear of doing those activities, fear of being able to do them to the level that you had been doing them at before. There can be just fear because of changes in endurance and fatigue that you're experiencing. And then also a lack of time, having to now balance and juggle multiple appointments, as well as having, the other responsibilities that you do have, work and family, can be really difficult to also just take time for yourself and find hobbies that you enjoy doing. So this is just a list to say there are a lot of hobbies out there that have been shown to be of benefit for cancer survivors. And really, it's not too early to pick up something new and to try something new. So if you had previously enjoyed something that you may not be as excited to go back to at this point, picking up something else is definitely a great way to keep your creativity and keep finding value in activities outside of your work and your personal life. So some of the things that have been kind of talked about are writing or poetry work, music therapy is always beneficial. Walking, jogging, getting out and moving, doing some gardening or cooking. And then yoga has been very beneficial as well as knitting. But there the list is endless. These are just some ideas of ways to find new hobbies. And then we just wanted to end this presentation on a couple of resources that you can use if you are not sure where to begin in a certain area. So local resources to the MGH community, we have a great supportive care program here. And there are a number of services that are embedded within the supportive care program, including acupuncture, yoga, floral therapy, massage therapy, music therapy. We have a sexual health clinic. We also have some support groups that are virtual as well as in person. So if you're interested in any of these areas, you can find out more on our website, or ask your provider about it. The MGH Lifestyle Medicine Program, which has been a great benefit and obviously is part of the reason why we're here today, because they put this beautiful lecture series on for us, but they also do one-on-one consultations and so that would be a great place to start if you're really looking at how to incorporate lifestyle changes into your care. MGH Palliative Care Services, which Laura is a part of and can really help with some of the symptom management that may be affecting your identity, as well as goals of care, helping you identify how to get to reach your goals. And then just to touch on therapy services, if you feel like a functional aspect of you is limiting how you're able to participate in the activities that you enjoy, therapy may be a great place to start. And I would definitely suggest talking to your provider. And then the cancer rehabilitation program here also is another place that you could go if you are not sure really where to start or have concerns about how to safely start a program. And then here are just some national resources that are available that you can take a look at if you have any questions or you want to look at more thoughts on identity and what evidence is out there for different suggestions. So in closing, we just had a couple of takeaways. Identity is shaped by several components, including physical, psychological, social, functional, and sexual aspects. Many cancer survivors experience change in their sense of identity after undergoing cancer treatment. If you are feeling that way, you are not alone. There are many avenues to pursue to reclaim parts of yourself that feel lost. Take that first step to seek out local resources from your oncology team or remote resources online, or connect with other people who can relate to what you are going through. And with that, we'll end the presentation and leave some time for any questions. So I'm going to stop sharing my screen.
Wow, that was such a great talk by both of you. Thank you so much. I did want to make sure our participants have the opportunity to ask questions or make comments, and you can use the chat box or the Q&A box that's at the bottom of the screen. So, wow, just so thorough, comprehensive. I did get a comment actually during the talk, really appreciative of you including sexual health in this discussion. So I think that was really helpful, and certainly we're so fortunate at Mass General to have a sexual health clinic for our patients and who are interested in learning more about to address those types of issues. And I know increasingly there's more awareness in the oncology world about the need to address sexual health concerns. There is a question actually for, maybe I'll start with Mitra. Is there a yoga program under, with the MGH services for cancer survivors?
There is, but I don't know all the specifics of how to get to that yoga program. I don't know, Laura, if you know more specifics about it, but I know there is a program.
We did have a yoga program, you're right. And even it was offered virtually. So I know on that website you shared, Mitra, with the supportive care services, there's a calendar. And I actually should know this if the yoga classes are still available on that wellness calendar, but that's a really great question. There is another question for both of you. After treatment, how long should I expect to experience fatigue?
It's a great question. Fatigue can be so variable and relate to a lot of different things. As I was mentioning, there are a lot of things that can be associated with fatigue. Not knowing the particular details of your treatment, which I don't expect you to share, I mean, I do think that would be a very reasonable question to ask your healthcare team, your oncology team, if you're seeing them, or ask your primary care doctor about, because some treatments really predictably cause fatigue, like chemotherapy or radiation, and we can sort of have some element of predicting what relates to those treatments. But then there are other factors that can also interplay with fatigue, like, as I was mentioning, mood symptoms, deconditioning, having less physical activity. And so some of those things can all sort of contribute to fatigue, as well as just other medications that someone might be on. So there are so many different contributors. So I highly recommend bringing it up with your team and sort of reviewing, so that you can get some more precise information as it might relate to you. But no matter kind of the cause of the fatigue, I think that message around increasing physical activity as you feel comfortable and able can be helpful. And some of those other strategies around kind of pacing yourself and identifying the times of day that feel like you have the most energy, and concentrating your activities around that time if it's a possibility for you.
That's great. Thank you. There is a question. Why do some people seek out acupuncture? I'm wondering if it's been helpful. What are the benefits that have been seen for cancer patients?
I can start out with that. There are a lot of benefits that acupuncture has shown in general, and as well as in cancer survivors. But largely in the areas of pain, there's been definitely some evidence that acupuncture can be really helpful for that. Relaxation, stress, fatigue are all areas that I know of that there's great evidence, or in terms of evidence for a lot of these complementary medicine services, but that there is evidence for acupuncture being helpful for, and I don't know if you have any other thoughts, Laura, but that's kind of.
Yeah, I think there are some evidence, some areas on studies that have demonstrated benefit. And then I also have noticed anecdotal benefit. So people just finding that certain conditions that they have or symptoms can be helped by acupuncture. Nausea is a big one. I've had people really find it to be useful for nausea, to be useful for insomnia, even constipation. There's like an acupressure point on the bottom of the foot. So if acupuncture is something that you might be interested in, ask your team about it. They can place a referral and or help you find resources that are local. But if people are undergoing treatment, there actually is an acupuncture team that can come to the infusion center and provide acupuncture while people are getting treatment. And what they'll do is just sort of check in with you and see what sort of things you're experiencing, and then make a recommendation and kind of tailor the treatment around what's going on.
That's great. Thank you so much. So it is 1 o'clock, so we're mindful of everyone's busy schedules, but thank you so much, Dr. McLarney and Dr. Petrillo, for this really excellent overview. This has been recorded, so we'll ensure that this gets on the MGH Cancer Center YouTube site for people who want to view in the future. So thank you and have a great day.